Hi, everybody. We're going to be starting our presentation for From Passion to Practice, Guide to the Medical School Journey, and the requirements that you could need to do in order to get into medical school, MCATs and GPA requirements. Waiting for our other host, Efrat, who will be presenting some slides. Okay, so does anyone want to? I think we're gonna start with just some questions while we're waiting. All right. So one question that we got during some pre-submitted questions is, how do you know how much time you should set aside for MCAT studying? So Dr. Jacobs, do you want to
Sure.
answer?
So, hi, nice to meet you all. I'm Lauren Jacobs. I'm a PGY2 at Mount Sinai Hospital in radiation oncology. I'm really glad that everyone came tonight to hear the seminar. So, that's really an individual question. As you go through your pre-med studies, you start to learn what kind of student you are in terms of time requirement, how you learn, and what study techniques best suit you. It's a huge skill that you'll learn starting medical school, and you'll use them throughout, especially med school, residency, and beyond. So really understanding the amount of time you need and the tools to study will help build that schedule in terms of repetition, in terms of laying out practice exams. It's really knowing, are you an auditory learner? Are you a visual learner? What sorts of resources am I going to use? There's a huge resource overload in medical school and pre-med. As you go through the classes, you'll see that from books to question banks to study guides, it's a ton of stuff. And so knowing how to siphon that and which resources to use and how to study is a skill that you'll develop. And then talk to an advisor in JOMA to really hone in on what that schedule may look like.
Our Another one under this thing is also, the MCAT study timeline. Should you study part time or full time? And um, like, how do you how much just yeah.
So that's again depending on how you study. But I think what most people have found very helpful is a dedicated amount of time to study. For the MCAT, which is, to not be confused, the most important part of the application. You can have all the volunteering hours in the world, you can have a ton of publications, and what you can take to the bank is your MCAT matters an enormous amount, the most. So what people have done historically and have found very rewarding is to take at minimum 2 weeks, sometimes a month, sometimes 6 weeks. It really depends on what your foundation is and where you are, and you assess that by a practice test, is understanding how much time you need in order to master the material to do well on the MCAT. And if that means pacing yourself over a longer period of time to really have that strong foundation in physics or in biochem or in genetics or in whatever you need to do that, it's really knowing where you're at and budgeting for that study time. So again, something to absolutely talk to a mentor about, but I would say 2 weeks at minimum of dedicated time is probably something worthwhile to build up the stamina to doing multiple question blocks a day, to being able to have time to review. However long it takes you to review that question bank, it's going to be about double the time it takes you to actually do it. You learn a lot from the questions that you got wrong and putting that into practice for your next test. So I would say a lot, probably 2 practice tests, at least a week apart, 4 days apart, and being able to have 2 data points going into your test, knowing how to allot the rest of that time.
I wanted to also share something that I saw online, was just somebody's who set up their study schedule. I thought that might be like some helpful, um, and just to get an idea of how to maybe set it up. Um, do you guys see this screen?
Participants Let us know if you guys see the screen or not. That way we can move forward with the Zoom call.
Yes, we can see it.
Okay, so you could see that someone's doing an exam once a week during her later weeks of studying. This is just an example, so it's not something that, you know, works for everybody. Some people's schedule doesn't really work, and for me, it was very helpful taking that MCAT, how to study for the MCAT, and using that to study for step one, and just using it for the rest of kind of your medical school career, I guess. So those are useful. Another question that we had was, what is more important, doing clinical experience like shadowing, working as a CNA, or EMT, or doing research as extracurricular activities for medical school applications?
So I would say in medical school applications, again, the number one factor to focus on, to do well on, is the MCAT. There's just no way around that. It is a strong data point that is used by every medical school, sometimes even filtering out people in an automatic way. So if your score does not hit above a threshold, they will automatically filter you out and not even see your application. So once the MCAT is taken care of and you've hit that threshold and hit that minimum, it's really important to focus on something that's authentic to you. So I know that there seems to be a lot of box checking in applying to medical school, and there are clinicals and there's volunteering. But if you're passionate about something and you want to do a project in global health, for example, it's okay to do research in that. It's okay to do a project in community health. It's okay to demonstrate a sincere interest in that and have things focused around. When you write an application and you have those elements to show your path, really, when you're applying to medical school, and a focus in your essays and in your application, it's okay to highlight those things. It often looks like you're checking a box if you do a month's worth of research. Culturing breast cells is not doing research. It's not checking a box. Everyone has taken lab sciences as a component of their chemistry course or as their biology course. So what applications for medical school really hone in are what do I bring to the table? Why am I going to be a good physician? What skills do I have to be able to demonstrate that I'm interested in being a doctor, and why? And what am I? Who am I? What makes me get up in the morning and my engine go? So I think if you want to focus in on something that you love, that's absolutely what you should be doing. And to add on to that, it doesn't need to be in your desired field. So as an example, all of my research throughout undergraduate was in malaria. So I majored in the biology of global health. So I was a biology major. I did classes like immunology and microbiology, and all of my research was in drug development for malaria. I ended up in radiation oncology, and they have a similar foundation in the sense of pathways and different things, but I didn't siphon myself off into infectious disease. You can do research in anything. You know, you'll get an opportunity to work in a lab, whether it's bench, whether it's clinical, and you'll get an experience of what it means to work as a team, to work in a group. Medical school, when you apply, really wants to demonstrate that you are a functional member of whatever unit that you're a part of. So if that means you're in a lab, you're in on an EMT crew, or you're in an office, that you are able to work in unity with other people in a medical setting for the good of the patient. So don't think that doing one thing limits you from going into something else. It's really malleable, and it's really skill building more than anything. Just because you do research in pediatrics doesn't mean you can't be an adult nephrologist.
Thank you. Um, are bioelectives part of the science GPA? Like, what is considered part of the science GPA? Um,
I think this lab sciences are counted. When I did my science classes, which were given a while ago, the labs, a science class was 4 credits, a lab component was 1 credit, and the entire total was 5 credits. So like if you took chemistry, the lab component was 1 credit, and Gen Chem itself was 4 credits. So the total being 5 credits, but it was a necessary component to pass the class. So you couldn't do chemistry separated from the lab. I'm not sure, that may be school dependent. So that's something to look up in your curriculum potentially, if you can separate them, like doing Gen Chem without the lab. I think in total it needs to be done completely, but you'd have to look more school specific for that. But I don't believe you can apply to medical school without doing chemistry with the chemistry lab, for example.
I also want to clarify that when you apply, because we didn't explain this earlier, and I'm sorry, but when you apply, you have a 2 GPAs, your cumulative GPA and then also your science GPA, and those are calculated separately. And usually the cumulative GPAs are usually around 3.8, from the statistic of the average accepted MCAT I'm sorry, MD applicant, and then, um the MCAT and the science GPA is around 3.66, if I'm not mistaken, but that's also gonna be more on the slides that we have that will be presented soon, and okay, and we have another question, from somebody on the chat. In addition to emphasizing your strong interests in the MCAT, what would you say are the basic benchmarks you need to hit with extracurriculars?
I'd say for extracurriculars, you need to demonstrate some sort of clinical experience, whether that's an EMT or a scribe. There are some positions that show more patient interaction than others. So that's really, again, talking to someone to evaluate the different opportunities. Then there's a sort of research project. Again, depending what you like, you don't have to sit at a bench for 10, 15 hours a week. You can do clinical research, you can do bioinformatics. I mean, there's a whole range of projects and different things. There's more psychology-based projects. It's really dependent on what your interests are, what you want to focus. But I think developing a project, especially being able to sort of own your project and understand it, know the aims. No one's expecting you to go above and beyond your level. Everyone knows you're a pre-med student. No one's going to be asking you to, run the assays of your lab and interpret them. It's really showing that one, you take the initiative to do something, that you have the wherewithal to work with either a PhD student or someone to really hone in on a project and follow a project to fruition. Again, it's demonstrating some key things that when you write your essays, you'll target teamwork, you'll target, your ability to sort of conceptualize an idea and take it from start to finish, how you would do something. So again, it's not so much checking off a box. Volunteering for 20 hours, while important, and you can write it in your application and it goes under a, certain section. Yes, it fulfills a requirement, but when you talk about yourself and when you apply to medical school, you want to be able to really demonstrate who you are and why you want to be a doctor more than anything, right? More than a researcher, more than a PA, more than a nurse. Everyone sort of fits a different role. And so as you go through and you start to pick activities, think of it less about checking a box, looking at sort of the requirements. And if you have 8 things that you do and not 12, that's okay. Be confident in your application, in that what you have there, you can really speak to and have it be something that you're proud of.
I just want to back up Dr. Jacobs' comment on requirements. So they do change from university to university. We would always like to recommend to our pre-med students at least a minimum of 80. You can go to the university websites of each university that you're interested in. For instance, Harvard's requirements is 40 versus like Columbia is 150. So you want to really find out what that hour number is that you have to reach, you can. But as she was saying, if you can speak about an experience that you've only done for 20 hours and really capture the interviewer's attention because you did it in full, then that will count a lot more than the hours you actually did.
Another question that we had was, will med schools accept people without research?
Yes. To the best of my knowledge, the answer objectively is yes. I think that research is one of those things, though, that if I was to recommend to do any outside activity, would be some element of research. And again, it's that project building, like I've been emphasizing. So it's not so much the research itself. Again, no one is expecting you to develop a cancer pathway or to develop, a new drug. But really, what they're expecting you to do is to be able to take an idea, again, alongside a PhD, alongside another person. No one's going to expect you, again, at a pre-med level to conceptualize an entire project that someone does a dissertation on. But what they will expect you to do is to be able to make a hypothesis, to be able to figure out how you would test a hypothesis, and then analyze it, right? What did I do right? What did I do wrong? What are future directions of my work? If this whole thing was, didn't yield anything, what do I learn from that? Because from every non-result is in fact a result that you learn from. So I think research of some sort, again, whether it's, a lab science or a social science or, a softer science, I think having that sort of project, and again, talking through with someone based on what your application looks like is really important. These are all really individualized questions. And so on the whole, yes, you have to look at a website like Columbia's, like Harvard's, when you go to apply, and make sure that you're hitting exactly what they're asking for to be able at minimum to apply. But you need to distinguish yourself. Why do I, Lauren Jacobs, belong in your institution? What do I bring to the table? And what is it about me that makes this medical school class unique? They'll ask you in a number of questions. I remember, what do you specifically bring in terms of a skill set that would make our class special or different? And so you learn about yourself as you go through your classes, what you like, what you don't like, what are skills of yours, what are shortcomings that you have to build upon. So it's a really amazing process. At the end, you look back and you go, wow, I learned so much about myself, and I can't wait to bring this to patient care. And that's a really beautiful part of medicine. You are constantly learning, and it is a long road. So don't despair. You will have plenty of time to continue to develop, but it is something that you begin to appreciate about yourself.
How would a pre-med get research experience? If you've never done it before, how do you go about trying to find research?
Yes, that's a great question. It's always daunting where to start, right? I'm new to this school. I don't know. I know that I have to take this, specific set of classes, but where do I start? I don't know anyone. I don't know any of the lab PIs. I don't even know what I like really. So where do I start? And it's to begin understanding that there is no wrong answer to that. So I had no idea that I was going to ultimately really enjoy biochemistry. I hadn't even taken the class. I had done one chemistry semester, and I ended up in this malaria lab by happenstance, emailing the PI of the project. And I ended up doing malaria research for the entirety of my undergraduate, and I loved it. And I never thought, that I was going to be doing, drug development in malaria. And so the crux of that really is there's no wrong place to start. If you look up a number of labs at your institution, say you are, at a college that has, a biology department, and they're doing some sort of mouse models on Alzheimer's, for example. Maybe you're not particularly interested in Alzheimer's, but it's not so much Alzheimer's. It's really the skill set that you're going to learn from doing those projects, right? Running those assays, doing the statistical analysis along with maybe a statistician that they have in the department. So I would say don't focus in so much on the topic itself. Again, you're not married to it. You don't have to become a neurologist if you did an Alzheimer's project as an undergraduate. It's really anywhere to start. And having a mentor that sort of guides you is more critical than anything, more than the topic, more than the lab itself. It's really being able to grow within a certain project. So I'd say anywhere you start is a good idea. And sending a number of emails and seeing what sticks is also a fine approach.
I really want to just piggyback on that email thing. When you guys do sign up for your mentor sessions with us, most of the time you use your surrounding resources. So you guys are going to do science classes already. You're going to do the bios, you're going to do the chems, you're going to do a biochem of some sort, another social science. And those labs, I, for instance, did it on pigeon peas that were grown in Turkey, and they're, vast range of genomes. It had nothing to do with medicine. It was just an opportunity to get into a lab. And it really was building a little email template and sending it to all of the science labs in the university. And one of them responded and said, we have a database position. And I obviously took it, but you can start with where you're at. And then we can also guide you if there are different departments on which template to use and what to ask in particular in regard to the position. But don't forget to use your surrounding resources.
Thank you. For the last submitted question, when is the last date you should take the MCAT, just in case you need to retake?
The application is due in March, April, a finalized application. Is that correct? When is, or May? When is the final date?
I think it opens in May.
It opens in May.
Or June, and then you have, whatever, till whenever, but it opens in May or June.
Okay. I think to be safe, I would say it takes, let's say, 8 weeks to process your score. I think safely to know that you're okay with applying, I'd say at minimum 6 weeks, 6 to 8 weeks before applying. I think regardless, you should have your application ready to go, your essays, everything sort of all your ducks in a row. And if your MCAT is the last thing pending, I think that's okay. But I would give yourself enough time to, if you decide to pivot and need to take it again, enough time to, allow for rethinking a strategy. So I'd say safely, if you really wanted to be safe, you could go as far back as January, because then that would give you a significant amount of time. But I don't think I would do it anywhere sooner than like 6 to 8 weeks, really. And that's being a little less cautious. So it's really a comfort level, depending on what your score is, where your data points are. A lot of these questions are sort of specific to your trajectory. If you need to get it up 5 points and you've studied and you know what your weak areas are, and you can more confidently know that the test score that you're going to get back is going to hit that threshold, that's very different than, a first time you really are not quite sure, you're a nervous test taker. Again, something individual to talk to an advisor about before, entering the process.
Thank you for answering all the questions that we have. Efrat, are you ready to present?
I'm here. I gave her to Dad because I don't know why I thought this was a good idea. It was not the best idea because, of course, your very well behaved baby is not going to be well behaved when you need to. So, all right. I'm going to pull up this presentation and share my screen. For those of you who don't know, by the way, I'm Efrat. Yarden and I are directors of the Premed committee. I'm an anesthesiology PGY4 at Mount Sinai. You can all hear me, right? I'm not like talking into the ether. Okay. All right. How do I share my screen on this Zoom thing? All right. So some of this information is like stuff that you know, but I think it's still, if you're a pre-med, you probably know this. I think it's still useful to go over it in like an organized way. So what are like the basic universal requirements? I know a lot of this was mentioned already, but in the United States, you need to have a degree to go to medical school. And I say in the United States because I'm pretty sure like a lot of the rest of the world, you do not need a degree necessarily. Like it's kind of, they have these combined ways of doing it. But here in the US, there's no way about it. You just have to have an undergraduate degree. Your major can be in anything. It does not have to be in science. However, within either while you do your degree or after, you need to complete a certain basic set of courses, which I listed here. I won't read them off. You probably know them. A lot of these are universal. There are some variations among schools. You can like check with if there's a particular med school you're gung-ho on going to, then, double check and see like, oh, do they have any special requirements, whatever. But most of these courses here are like going to be required at 90% of US medical schools. Third official requirement is the MCAT, which I know we spoke a lot about, tends to be kind of one of the harder parts of the application. And then extracurriculars are not official requirements, but it's self-understood that when you apply, you're going to have a collection of extracurriculars that you'll be able to talk about. It's just not moving forward. Sorry. Okay. How do you apply to medical school? So there's 2 routes, the MD route or allopathic route, however you want to say it. It's an electronic application. You're going to fill one application out, get sent to every single school. And then there's the DO or doctor osteopathy route, and it just has a different electronic application. Practically speaking, there's no major difference between an MD and a DO. They both land up in the same spot. There might be some differences in the types of tests you need to take, and there are much fewer DO schools. It is a little bit less competitive maybe to get into DO school, like, or it used to be. I'm not so sure that even applies today. I think they're both very competitive. But at the end of the day, they're the same thing. Okay, so what's going to go into your application? Like, what are the parts of the pie, so to say, of like, you have this giant pie, like what's going in when you apply to medical school? What are they going to see? So they're going to see your college transcript, and they're going to see transcripts from every post-high school institution that you ever attended. This is important because you may not be interested in seminary or whatever it is, but the scores you get are going to be seen, may or may not count toward the GPA that MCAT calculates for you. So you got to be a little careful with that. Like, you should try to get good grades whatever you do, because they're going to see everything. They're going to see your MCAT score, and I put an S in parentheses because if you take it more than once, they're going to see all your scores. Extracurriculars. Back when I was applying, it was you pick 3 that are most meaningful. Is it still that way? I don't know. Like, they change things around, but I'm pretty sure you can still select a certain number that you would like to deem your most important extracurriculars. Letters of recommendation, those are very important, and personal statement, also important. What happens after you apply? So the schools are going to send you secondary essays. They're just going to make you write a lot. Save everything. There's tons of repetition. Then they will either offer you an interview or not offer you an interview. And then after the interview, you're either accepted, not accepted, waitlisted. So these statistics are actually from like 2 years ago, but I'm sure they didn't change drastically. Basically, half or less than half of people who apply to med school don't get in. So, right, that tells you something about the competitive nature of applying. And then I once heard the statistic, but never verified it, that half of people who get accepted to medical school get 1 acceptance. So I can't verify if that's true, but it's competitive, as I'm sure you know. I don't have to tell you that. Okay, so again, these statistics are from 2020, 2021. However, on the bottom, I looked up the updated numbers. It's not that super different, so I'm still going to go over the slide, but the mean score of people who take the MCAT is 500, with a standard deviation of about 10. So the mean score, the difference between the mean score and we'll see soon the score of people are accepted is about 1 standard deviation. So they want to see that you are at least 1 standard deviation above the mean. Is kind of at least where you should be. So in that cycle, 2020, the mean score was 511.5, whatever, for practical purposes, like that's like a 512, which is the 82nd percentile. And then in 2023, it was up. That may not seem like a big difference, but when you're looking at 85,000 people, that's significant, right? Like, it goes up a little bit every year. So you have to be in the 82nd percentile to have a score that's the average score of the accepted applicant. So put another way, if you had a room filled with 100 people taking the MCAT, you would need to score better than 82 of them to be an average accepted applicant. These are also numbers, and then the parentheses are updated numbers from 2023. I don't have to tell you this, but average accepted, people have a high GPA. That's like, I'm sure you all know this. This is the timeline, which I think is important to go over. I'm not sure I understood this when I was a pre-med, but basically it's 4 years of college, 4 years of med school, 3 to 7 years of residency, 1 to 3 years of fellowship. The fellowship part is not something you always have to do. It depends on the specialty you want to do. And then you're called an attending physician. So it's a long road. Make sure it's what you really want. What are you called at each phase? So in the 4 years of college, you're a pre-med student. In the 4 years of med school, you're a med student, student doctor. In your 3 to 7 years of residency, you already have an MD, so you are a physician. But you are working in an environment where you're being supervised with increasing responsibility as you move along. And then fellowship, that's optional depending on which specialty you're doing, and then you're an attending. Just some key facts at the very minimum, the training will take you 11 years because the shortest residency out there is 3 years. So 4 years plus 4 years, 8 years, and then another 3 years makes 11 years. Until you aren't attending, you will work under the supervision of more experienced physicians. And then a first-year resident has a special name called an intern. An intern is a resident in their first year. These are some examples, just to give you a sense of the timeline. Some specialties take really long. Like if you look, for example, at a neurosurgeon here, that takes 11 years, but it also takes 11 years to be a maternal fetal medicine specialist. And this is something you should think about when you're choosing a specialty. Like there might be something you really like, but do you like it enough to put another 3 years into it? Like maybe, but these are all things you should understand and know. You're going to get these questions. People are going to want to know what the difference between a doctor and a nurse or a nurse practitioner and a PA. And it's sort of important to have a sense, not just of like the definitions, but the training that goes into these various specialties. So I won't go through this entire, slide. You can read it on your own. But if you just look at the bottom at the years of post-college training, physicians have 7 to 11 years, nurses 0 to 2 years, nurse practitioners 1.5 to 4, PAs 2 years. And then I know people like to say, oh, well, the PA who's working for 11 years has the same experience. And there might be some truth to that, but it's not the same thing because when you're a resident, you're working in an environment that's constantly holding you to certain standards and like expects you to progress in a certain way. So that's a little bit different than just someone having experience in a field where no one's kind of kicking you in the butt and saying, this is where you need to be now. You need to do this better, which is kind of what happens to you when you're a resident all the time. This is a sense of the amount of hours you're going to have to put in if you want to become a doctor. The hours are a lot. That's like when you're finished training, you'll have done like 15,000 hours of clinical training. And then you could see, kind of, these are all averages, right? That a PA, for example, or a nurse practitioner has to put in. This is just a slide I thought I'd throw in because, we don't think about finances, but maybe you should. I won't go over the entire slide, but I will say, as I'm sure you all know, that going to medical school is pretty expensive, depending on where you do it. I would just recommend that you try to get as financially literate as possible because this is probably the most neglected topic in our entire medical education, but it's important because you're going to be putting money into it. You'll be relying on this to support yourself probably. And kind of just a general rule of thumb I like to tell people is that you should try to be in a specialty where your annual salary is at least as much as or higher than the debt you're coming out with. At a medical school, you're 50,000. I would recommend, again, your life is yours to choose how you want to live it, but I would recommend picking a specialty where your annual salary is at least $250,000. If you come out of med school debt free, then obviously do whatever you want and good for you. But just a nice rule of thumb I like to recommend to people, and that's the last slide. All right, any questions on these slides?
If you have a slide you want Dr. Bruck to go back to and explain or look closer, let her know.
Any questions? You can put them in the chat. You can just speak.
Can I ask a question? So I was wondering, you showed the slide with like the progression of the years. I've heard about 3-year medical schools. Can you just explain what the whole story with them is?
Back the slide.
Sure. I don't, what's up?
You put
You go
back.
back. Yeah.
Like I've heard Stony Brook has a program, NYU has a program. Like I've heard of a few.
Yeah, I'm just trying to figure out how to share my screen again. Okay, let me share my screen again. This slide?
Yeah.
Okay. So, yeah, some have that. Let me get there. I didn't go to a 3-year med school. I think they basically just condense it, and it's gonna obviously be harder because, even doing med school in 4 years is kind of hard. I think the caveat to 3-year med schools is you need to know the specialty you're choosing. That's kind of like the catch there.
Okay, thank you.
Mm-hmm.
Does anyone else have any more questions?
Hey, I have a question. It's about the MCATs in general. I'm still a sophomore, so I'm a ways away from that. But I got a couple of Kaplan MCAT books just to look through material, familiarize myself a bit. And I realized that there's gaps in materials that I've already taken classes for, like basic bio 101, 102. There are gaps in the material I learned in class versus what's covered in the books. That being the case, how soon would you recommend I start studying, or not actively studying for the MCATs, but to close any gaps in my knowledge before I start MCAT prep?
I'll take this question. So my general rule with the MCATs is, I've never heard of anyone taking less than 3 months to study, like a dedicated period. Like that's the absolute minimum. And my rule is you should be scoring a 500 on a practice test before those 3 months. So if you take a practice test under time conditions and you score less than a 500, you're not ready to do a dedicated. And like you're saying, there are gaps in your knowledge. Now, how to fill those gaps in your knowledge is very individual. You can't give one answer that is going to suit everyone, but that under 500 tells you you're not ready yet. I had this issue with like physics because even though I got A's in physics, apparently they were like not really meaningful A's, because when I went to study for the MCAT, like I didn't even understand what the questions were asking me. I had to stop my studying and literally relearn, college physics, but there's no other way to do it. You can't like fudge your way through a topic. There are a lot of free resources out there, Khan Academy, there's other stuff. I actually reached out to my college and told them, hey, look, I'm studying for the MCAT and I don't know any physics and you gave me an A, so can you help? And I sat down with one of the professors there, like we made some sort of study plan, and I used to meet with them periodically and they would help me out. So how you want to fill those gaps in is like up to you, but I can give you a metric sort of to tell you that if you're scoring under a 500 in a practice exam, you're not ready to put in the 3 months. And a lot of people take more than 3 months to study for the MCAT, and that shouldn't make you feel bad. You should just do whatever it takes to get a good score. Because if you score low on the MCAT, you're going to get filtered out and no one's going to see all those wonderful extracurriculars you have on your application.
Thank you. And as a follow-up, there is an overabundance of MCAT study sources. If I want something that is condensed, meaning doesn't give me too much extra so that I know what to really focus on, what would you recommend?
I'm going to give this to people who study for the MCAT more recently than me.
So I'm going to take this question. Again, this depends on your study style and how well you retain information. So there are auditory learners, there are visual learners, there's people who need to annotate, there's people that have a combination of two. The resources that are out there have all of those components built into at least a minimum of 2 months courses. I'm sure you've heard of them, Princeton, Kaplan, et cetera, et cetera. I highly recommend, and I hope that you guys are all going to be there at the conference in January, because we do have something for you guys in combination with one of those MCAT prep courses. But I highly recommend to invest in one of those courses. Dr. Bruck was clear about trying to like supplement and fill in the gaps while you're in your basic sciences. And again, never sacrifice your grade to try and deal with something that's years ahead. So if you know you're struggling in physics, but you want to fill in the gap for the MCAT, the hierarchy wins. The grade is first, and then you will deal with the MCAT later. having said that, once you get to the end of your basic sciences, training for an exam and how to sit for an exam is very different from getting a degree. So you're learning how to sit for hours at a time. You're learning how to read question after question after question and not trying to get fatigued out. It's all in one component. So it's best for you to, right after these degrees, your associates, your bachelor's, dedicate those 2 or 3 months. You can buy a course, or you can even build one with us, if you're not someone that is able to have that kind of resource spot. And then you're working just on how to address those physics, biology, chemistry questions for the MCAT itself within those books. And you're not going to apply everything you learned in the courses in the university. It's about how much you can utilize for the MCAT, not everything you know about the topic. So definitely first things first, like invest in a course. That would be great. But if not, we can always build a course and go from there.
Thank you so much.
I have a question. What's your opinion on people? I know that it's like very popular now for people to take a gap year. Do you recommend it? Do you think it depends on the person? What's your opinion?
I can take this one. So I think it really does depend on the person and the sort of work that you're doing, what the goal of your gap year is, and what it accomplishes for you in the end. So I took 3 gap years between college to medical school. It was actually supposed to be 2 years and it turned into 3. It was a project I loved and ended up not being able to leave. And it was a great decision for me. It, again, is a very personal decision. It depends where you are in your application. I had already taken the MCAT, so it wasn't something I didn't need to balance working on a lab project with the MCAT. Again, building in that time necessary to do well on the MCAT is priority number 1. So really, if it works with your schedule, if you're at a point in your application where you feel like this is very beneficial for you, it's a good idea to talk to someone, talk about those pluses and minuses, and then figure out if that is something that individually would benefit you in the long run as a medical student beyond, and especially where you're at now.
Thank you.
Someone asked the question, what does a specialty in OMM or OMT look like? I'm in a DO school, so I've only had experience with like the professors who I've seen who taught OMM in our school, and some of them had private practices and would practice in their practice like only OMM and doing certain practices like that. But I haven't really seen it done in a hospital. But I've only been through a few rotations, so if any of the other doctors here have seen OMM or OMT done.
Actually, on my palliative care rotation, my intern year, we consulted OMM quite a bit. It was a big university hospital, so they were able to have OMM, but it is something that patients who are talked to and appreciate, depending on, a different, whatever condition that they have or, where they find themselves, it is something that I have seen consulted in in an inpatient setting.
I'm just answering something on the chat. When you need to know what specialty you want to go into. So, at the very latest, it would be at the end of your 3rd year of med school, but for some competitive specialties, there's like an unofficial list of requirements or unofficial research you have to do. So you have to know a little earlier because you have to do all those unofficial requirements. But you apply to residency at the beginning of your 4th year. So at the very latest, by the end of 3rd year, you need to know. But if you're applying to neurosurgery, for example, or dermatology, or some other, urology or orthopedics, because they're more competitive, and especially now that step 1 is pass fail, you probably have to do research, and you can't like scrap together some quick research right before you apply, right? You have to like dedicate chunks of time to that. So for those, you need to know a little bit earlier. And if some people, if they decide too late, so then they take like a gap year to do research. But you don't have to know when you start med school. That's definitely not, you don't have to know that early on.
Another question that was sent to me are tips on maintaining a religious life while in medical training, like clinicals on weekends, call shifts, etc. How to advocate for yourself.
I mean, this is a topic that we obviously have set aside for a whole other webinar because there's just so many levels to it, you know, let alone just in medical school, in college, then in medical school, and then in your workplace. The short answer would be building relationships with your higher ups and finding places that you really want to go to and dedicating the exact amount of time you need to go to those places. So there are, yes, Shomer Shabbat programs that you can really, really dedicate your time to trying to get into. As Dr. Bruck said, though, it's extremely competitive, let alone just piling on trying to get into med school. Now you're one of how many of you wonderful students on here, or there's 24 of you now, or more earlier. All of you probably want to go to that same spot. What are you going to do to be the one person that they pick to go there? So let's say you don't go to an institution or facility that, you know, abides by those rules necessarily. Your residents, your co-residents are people that you can utilize. Again, use your surroundings. Your chiefs are the people you need to communicate with the most. Putting yourself up front most of the time in a very specific way, and there is a specific way to do this. You can't just kind of walk in and say, hey, I'm Jewish, I have things I observe. It's very obvious. You know, because then there's other people that have their own stuff that they need, you know, attention for. But there's a specific way to address it to the higher ups, the program director, the chiefs. Then you move down the ladder and you work with your co-residents to see if they can help you switch shifts. You know, if you're on a Saturday and they're on a Sunday on a floor ward shift, you know, if you can switch those two, what kind of communications you can build with your co-residents to make it easier for you. It's a ever evolving process that you will always have to advocate for, and the best way is always to be forefront first and transparent. But it's a little bit more elaborate than that. Definitely, if you have specific institutional questions, book like a shadowing session, a mentor session with us, one of our mentors, that we can actually pinpoint, you know, where you need the help. And then we'll also have a future webinar on it to really get down to the finite, because it's a very specific thing.
Also, can I ask a question, please? So I was told by a doctor that you could graduate and become a physician by doing 4 years of medical school and 1 year of residency, and then you just won't be able to take insurance, but you'll be able to practice. What do you think of this route?
I think they mean that so you get an NPI after you finish step 2. So when you graduate from medical school, you're either an MD or a DO, and then you finish step 3 and you have a DEA number. So when you go to prescribe medications, you call up, say you're making, you know, putting in a prescription, you know, you've already had your NPI, now your DEA does allow you to write a prescription, but I've never heard being able to practice without completing a residency. I mean, you technically have the numbers for a prescription, but I don't know, Dr. Goldman, I've not heard doing that. You're on
Right.
mute though.
Oh, you would do residency just he said just for 1 year though, like instead of having to do at least 3 years and something.
The thing is, you might technically, so first of all, this is going to vary state by state because every state has its own requirements. So maybe in some states you can practice medicine after 1 year of residency because you can get a license after 1 year of residency. But I would say so again, state by state, you may need to be supervised by another physician if you're doing this. So and you can't get board certified. You're never going to be a board certified physician if you don't complete residency in that specialty. So like if you want to be board certified in internal medicine, you have to do the 3 years of internal medicine. It sounds like a shortcut that's not really worth taking unless you have a very good reason. Like, I wouldn't recommend going to medical school and going that route. Also, you're going to be very behind your other colleagues who all did 3 years of residency. You're 2/3 behind them, right? So you're not going to be like a competitive doctor that people want working for them. But, if your goal in life is just to do that and be supervised, maybe it's an option. But I wouldn't really recommend doing that.
Would you
I'm
be able to
curious-
do private practice?
I think you'll need to be supervised by another board certified physician if you only have 1 year of residency under your belt. But you can go back to this person and ask them. I'm curious to hear myself.
Yeah, I would love to talk to whoever, if you feel like maybe there's something that we don't know, but I think what you're referring to is called moonlighting, and you can do it after your second year of residency, essentially at the end of your first intern year. And you can go out and you can practice while you're still in residency. But as far as my knowledge carries me, is completing residency is a requirement of the entire MD program. You're not going to be able to find a competitive spot out in the market anywhere without completing residency. It'll be a mark against you, unfortunately. And that's a shame considering the amount of years and studying you're going to do, even if it's possible in some rural areas that might not necessarily have the same, rules.
Thank you.
We have another question here. When sorry, how long is there an expiration date to one's MCAT score? Like how long can one's gap be after taking the MCAT?
I think okay, so that changed recently. It was 5 years. It is program dependent as well. They will assess you based on your overall GPA and scores, and then they will obviously pull in your MCAT. If your MCAT's older than 5 years, or it used to be 5 years, plus however your GPA looks, if it's not so good, and then you have a 5-year-old MCAT, and then you have to explain what you were doing for the last 5 years to kind of be like, why did you wake up today and decide that you want to go back into this program? That will kind of throw you out of the pool. But I think that it changed to a longer period of time. I'll get the right years for you, but more than 5 years would be a difficult effort to use the MCAT.
Does being a thank you. We also have another question here. Does being a non-traditional applicant, being older, etc., factor into applications or acceptances?
In a good way. I mean, Lauren, you want to? I mean, so many opportunities there, actually.
Yeah, I loved it. I applied to medical school when I started medical school. I matriculated at 25. And when I graduated, I turned 25 the September of starting medical school. So we matriculated August. I turned 25 in September. And those 3 years of my project were something I wouldn't change for anything. It was a huge growing experience. It was an amazing opportunity to develop a number of different skills. And I think that the average age of applicants is only getting older for medical school. So many people are coming in with an MBA from prestigious institutions. They're having done a sort of global health fellowship. Some people change careers entirely. Like they started out as banking at Goldman Sachs and they decided that that career wasn't for them. So you see people from all different walks of life, and it only benefits you. You come in with a higher level of maturity, a greater understanding of yourself, a greater understanding of patients. You really can relate and empathize to different plights of different people coming from different places. And so if you think that that would be beneficial for you, I highly recommend it, but definitely talk to someone who, can guide you. They will ask you when you do an application to medical school to account for any years since graduation and what you've done. And you really should be able to speak to what you gained in those years. So, I'm sure any of the advisors here would be more than happy to talk to you, but don't be scared of taking the years. I think it can only help you.
Yeah, to piggyback on this, that's actually one of my favorite demographics to work with just into getting into medical school. Obviously, the younger the better. You get out earlier, you live life, a little better. But the experience and the way the interviewers react to you and the way that the medical school application process works for you as a more seasoned individual in life, is that they respond really well. They respond really, really well. So I wouldn't be worried or afraid of that. So talk to us.
It's not gonna count against you if that's what you're trying to get at. It's not gonna count against you at all.
We also have another question. Thank you. How did you decide to be an MD or DO instead of a PA or NP?
This is a great question that they ask you on almost every interview. So you're going to be asked, as a PA, you could finish in 2 years, you'll make a good amount of money, you'll come out sooner, and you'll have direct patient contact. So why are you going to go through all these years of medical school and what does it give you? Why are you not a PhD researcher? If you've done all of this research, why not have gone into, if helping people is the reason, what you could help tons more people having done research and developing a vaccine versus going to medical school and instituting that biomedical approach of per patient care. So I think that this is a question asked on every interview. And I think it really boils down to scope. As a doctor, you have a scope that encompasses a huge amount of responsibility with amazing skills that only become more refined over time, but you wear many hats. So a PA doesn't do a residency, for example. So you can go from being a urology PA to being a neurosurgery PA without having to do a residency in anything. Whereas in medicine, to be a urologist takes 5 years of a surgical residency. So I think when you talk about going into medicine, it's a careers long understanding of developing a certain skill set and opening up a scope that really hones in on one particular specialty with the ability to help patients widely within that scope. So I think all of us can happily say that we went into medicine, and it's more than helping people. It's really developing this set of skills in a particular specialty that allow us to help patients in the most advanced, precise way that we can.
And there's so many ways to answer this question. So again, definitely because this will be on, like she said, your personal statement, it'll be in your interview questions. So definitely hone in on yours, talk to one of your mentors and we can finite it. But knowing yourself really well and what you want to do as a doctor in the field, I'm sure some people can resonate with this. I don't necessarily like to be told what to do. I like to govern. I'm really good at it too. I'm able to convey in a very leadership way to my team certain things that I need them to do for patient care, patient safety. It's something that I'm good at, that I know I'm good at, and that I enjoy doing it on a daily basis. And I know that I know that I'll be better in this position than, for instance, a PA, which does have to report in some degree to a higher up, or sometimes nursing is a little bit less decision making, it's more execution. So knowing those differences about yourself is really important.
Thank you. We also have another question here. If I don't get into medical school in the United States, but I'm able to in Europe, can I come back after and do residency in the United States?
Very hard, very, very hard. It's not impossible, and I've seen plenty of people in the field do it. Again, this is a question of how good your residency, how good is your medical school experience going to be? Can it transfer easily to American standards? You're going to have to be able to have the opportunity by your institution to take your step 1 and step 2, and that is really going to rule you in and rule you out. Because if you can't take the step 1 or step 2, there really is no way for you to practice in the States. So it's not impossible, but it takes a lot of research as to where you're going to go and how you're going to have the opportunity to come back.
Those are all the questions that I had on the chat.
Did we answer Rachel Katz's last question about the board certified?
No, I don't think so.
So no, you do not need to be board certified to practice. But as I mentioned earlier, it is almost impossible to find yourself in a really good position unless you're a very innovative and financially stable individual to make your own practice away from insurances and away from hospital settings. It'll be challenging, and this kind of gets into medicine hierarchy and how they kind of put stops so that sometimes doctors can't move in many directions because of that. But no, you don't have to be board certified. There are some that practice without the board certification. It's very hard to practice in a good way without the board certification.
Yeah, that makes sense. Thank you.
What if you know from the get-go that you want to practice OMM and have your own private practice and not take insurance? Like many DOs don't for that, like when they only focus on OMM.
If you want, I could email my professor maybe, and I'll ask her about that because I think that's very specific. I think you'd have to talk to somebody who really practices OMM specifically.
Yeah, that would be
'Cause I
great.
don't know how that works necessarily. Like all the ones I know went to a residency that was OMM or like did a fellowship that was aimed at exclusively practicing OMM.
Yeah, that would be great. Thank you.
All right, guys, it's 9 o'clock. Definitely, I think Lauren and I are happy to answer any more questions if you have them at this point. But if not, you are welcome to email us at premed@joma.com. You guys should be very, very familiar with that email. And we're happy to help you with all of your processes. Okay?